Story 1. Are you getting treatment? I'm really just rolling my foot on a frozen water bottle. I'm not sure it is going to work this time. Story 2. Recovering from a sprained ankle sustained while cycling, I treated myself by binge-watching hours of anime. Story 3. I cannot take non-steroidal anti-inflammatory drugs for more than a day or two because I am on blood-thinning medication. So I am treating my chronic pain with 1. Heating pad. 2. Rest. 3. Shifting positions to avoid stiffness. I go from sitting on the bed to a rocking chair to lying on the heating pad. 4. Watching anime to avoid boredom. 5. Crying. Story 4. Physical therapy. I had a dry needling session the other day. It was a horrible experience, but it produced a great result. Story 5. If the pain is severe enough, I hope it kills me. If it is not, I reply to Reddit posts that interest me. This one caught my attention because I live a boring life and want to see who else is in pain and why. Story 6. I have fibromyalgia and a couple of injuries from overtraining. I use duloxetine, physiotherapy, psychotherapy, and a lot of personal work. Story 7. That's the fun part. You don't. The medical community is so squeamish about pain because it royally fucked up the United States with oxycodone overprescribing, and no one is willing to even attempt to treat pain anymore. Personally, I think it is trauma-induced neglect of their duty to care for patients. It is understandable, but it is also a dereliction of duty. The medical community at large needs to fix it, because being sheepish about helping patients who are suffering is not an acceptable choice. Story 8. We are friends now and know each other. We live together in the same body, mind, and spirit. Story 9. Mostly ignoring it and taking my Tylenol. Story 10. Tequila, because the goddamn junkies have given doctors the perfect excuse to be overly cautious when it comes to prescribing pain medication. Story 11. 12-mile ruck march in 2 hours 10 minutes on Monday. 5-mile time run on Thursday in 33 minutes. I am dealing with it by not training legs this weekend and drinking until I pass out. Story 12. Medical cannabis is an effective pain reliever. Story 13. My lower back hurts, so I keep squatting to relieve the pressure. It is pretty effective. Story 14. Laugh out loud. I wish. I have had a chronic pain disorder for over 15 years, and no amount of being told to just take the medication helps. Story 15. Cannabis. I have had 2 back surgeries and had to wait 10 months for each in torturous pain. Story 16. Are you a chronic pain sufferer? Original poster? I wish more people and doctors were willing to prescribe opioids, even though I understand the risks associated with them. Most importantly, I wish the stigma surrounding opioids and people who use them would disappear. Many people are miserable, and opioids not only alleviate pain but can also ease anxiety and depression. The euphoria they sometimes produce should not be stigmatized. Story 17. No treatment. I am just ignoring it at the moment. If it stays as cool as it has been, I will probably go out for a walk, which tends to help. I could really go for a few espresso martinis, though. Story 18. I get severe period pains every month. Ibuprofen relieves them every time. Story 19. I have had lower back pain for more than 5 weeks. I have been ignoring it because I am focusing on other ailments. Story 20. I have been ignoring it, and I have lived with it for nearly 20 years. Story 21. I think I broke 1 or more ribs. I am not lifting anything, and when I need to lie down, I start from a seated position. I lift the leg on the injured side with my arm, so I do not have to flex my abdominal muscles. I brace with the opposite arm and slowly lower myself. Adjusting while lying down is uncomfortable, so I take a deep breath and move slowly. I use ice packs, rest, and distraction to take my mind off the pain. Story 22. I'm just hoping it goes away. I don't have insurance and barely make any money. There is no way I am going to a hospital for anything. The debt would ruin me. Story 23. I have chronic lumbar pain. I am seeing a pain management specialist. We are trialing whether a nerve ablation of the facet joints could be effective. Steroid injections helped for a while but wore off. I have had acupuncture, which helped somewhat with the pain. I also do warm water exercises at the gym a few times per week. Story 24. I am obviously going to cut off whatever hurts with a giant machete. It is the only way. Story 25. Water or a water-based beverage, salt, iron, and compression. Story 26. I have pain from polycystic ovary syndrome. My doctor put me on metformin, and I have been working hard to lose weight and cut out carbohydrates and sugar. Story 27. I have back pain from carrying my 10-month-old. I go for a run on my lunch break 3 to 4 times a week. I swear it helps so much to unlock everything. I do a small stretch afterward, shower, return to work, and I feel like new. If I do not run for any reason, the back pain gets worse and worse. A week ago, I went a week and a half without running because we went on holiday. I used heat therapy by heating a fabric bag filled with lentils in the microwave and wrapping it around the painful area of my back. It helped a little, but it only got completely better once I went for a run again. Story 28. I had a tooth pulled on Monday. I am taking medication and praying. The medication helps. Story 29. Like the generations of individuals in my family before me, I just stuff it down and stop being a sissy. Pain isn't real. It's just weakness appearing in the body. Story 30. Joint issues are hereditary on my paternal side. My shoulder and knee will need surgery to fix them. Story 31. 2 extra strength Tylenol. Damn. Now I'm going to get autism. Stupid Robert F. Kennedy Jr. Story 32. I have epilepsy, and tetrahydrocannabinol is life-changing. Geet helps my sore muscles. Story 33. I had a busted disc in my lower back 11 years ago. I had to crawl for 2 weeks before I could walk again and never went to the doctor. My back is in horrible pain all the time. It has become background noise because I have children and do not have time to deal with it. I am not sure what they could do now anyway. Story 34. Icy hot patches. Daily physical therapy exercises. Occasional Tylenol or ibuprofen. Cannabis. Story 35. I'm not. If I use painkillers too often, I'll develop a tolerance. I'd rather suffer through small and medium pains so that when major problems come my way, the medications will work better. Story 36. Sometimes when my medication has not taken effect yet, I find that something that distracts me, such as music or conversation, helps. Story 37. Original 12-minute foundation workout. Do this every day. No back pain ever. 10 years free of chronic shoulder, neck, and back pain. Story 38. I take Tylenol arthritis for my arthritis pain. I use Ubrelvy and Botox for my migraines. I take Cymbalta and medical marijuana for my back and joint pain. Story 39. No treatment. Just keep pushing. Pain lets me know I'm still alive. Story 40. I have a weird twinge in my left knee, and I'm using a knee brace that helps a bit. It will probably go away in a week if I rest, but staying still drives me insane. Story 41. Epidural steroid injections and radiofrequency ablations, along with over-the-counter non-steroidal anti-inflammatory drugs and celecoxib, are used with physical therapy and a controlled diet. Story 42. I am going into a dark place. I have been trying to fix it for a year. Story 43. I move my finger back into place, hoping it will stay, and I ignore the pain in my fingers to get things done. Life does not stop for pain. Even when you want to stop and cry, life moves on, with or without you noticing. Story 44. Tylenol, ibuprofen, walking, and stretching helped. I posted this morning about significant torso pain. It felt like I had been hit by a truck, and most people suggested seeing a doctor. Despite medical advice on Reddit, a combination of pain relievers and anti-inflammatory medication plus a long dog walk made me feel much better. Story 45. I broke my femur 2 years ago. Even though it was declared healed, it still hurts, a constant dull pain. I live in Florida, and it is basically impossible to get pain medication unless you have the right doctor or know someone, so I have been managing on my own. Story 46. I am lying on my bed with a heating pad, smoking my Benjamin and mentally preparing to thug it out at work tonight. So far, the method that works best for me is to thug it out because no pain medications help the way I want them to. Story 47. Rest. Give the affected area time to recover. Ice or heat. Use ice to reduce swelling for recent injuries. Use heat to relax tight muscles and relieve chronic stiffness or tension. Gentle movement. Light stretching or walking can prevent stiffness from getting worse. Story 48. Voltaren cream and a knee brace. I am forcing myself to stay in bed and keep off my leg. Story 49. I cannot take ibuprofen because it causes stomach ulcers. I cannot take acetaminophen, commonly known as Tylenol, because my liver enzymes are elevated and it does not relieve my pain. I cannot drink alcohol because it makes me sick and causes hives. I cannot use tetrahydrocannabinol because of my job. The only thing that has worked for me in the past is opiates, but I cannot get them because misuse and restrictive policies have limited access for chronic pain sufferers. I use heating pads and ice packs on rotation to help with inflammation, and I cry a lot. I was seeing a pain doctor, but she seemed more focused on giving painful injections than treating my pain. White-knuckling through life is a level of hell I would not wish on my worst enemy. Story 50. I suffer from irritable bowel syndrome and many other conditions. So sadly, I am in constant pain every moment of my life. Story 51. Resting on the couch. I ran 17 kilometers today and have no plans afterward except to hydrate. My feet are elevated. No time for acetaminophen or ibuprofen. I am just toughing it out. Story 52. My go-to medication is Vimovo. It has no side effects and no risk of addiction. Story 53. I have sacroiliac joint pain that is minor, to be honest. I am using physical therapy, heat, and ibuprofen. I also have chronic headaches localized to the left side, with pain rated 5 to 7 out of 10. A neurologist is unsure of the cause. Story 54. A few weeks ago, I went to the doctor about calf pain. I was very concerned. They gave me an injection of pain medication, and I was amazed at how different my body felt. I had become so used to general body aches that I did not notice them anymore. Story 55. I am recovering from a cesarean section. I would not say I am in pain anymore, but there are points during the day when I am physically uncomfortable and a bit sore. I am treating it with ice cream and alternating between lying on the couch and walking around with my baby. No exercise yet, but the walking helps. Hot baths and back massages are also a godsend right now. Story 56. I have hemorrhoid pain. I am taking sitz baths and sitting on a donut pillow at the moment. Living the life. Story 57. I have a bad knee. I have had some luck with weight loss, drinking water, stretching, arch support inserts, and cannabidiol gummies. I am not a big fan of painkillers, so I avoid them. Story 58. I am not. I will take a hot bath later, but I cannot take ibuprofen, and acetaminophen does not relieve menstrual cramps and sore muscles. Story 59. I had a triple coronary artery bypass graft surgery. I am in the intensive care unit before transfer to the step-down unit, with drains and tubes coming out of everything. I receive 975 milligrams of acetaminophen twice a day. Hydromorphone injections of 1 milligram are available every 4 hours on request. I am not using all of them. Occasionally they give ketorolac intravenously. It is uncomfortable but much smoother than I expected. I am in Quebec, Canada. Story 60. I am almost always in pain. I have a bad back, painful knees, and one eye that hurts all the time. Most of the time I ignore it. If it becomes really bad, I take ibuprofen. I suspect it will progress to the point where I will need stronger medication from my doctor, but I am trying to avoid that. I cannot use cannabis because of my job. Story 61. My lower back pain goes away only when I correct my core and head posture, so I have to sit up straight at all times. Story 62. I live with it. Stretching helps a little. Massages help when my partner offers. Story 63. I researched muscle groups, organs, nerves, and so on for the areas where I was having issues. I also researched which exercises, supplements, and routines help with those issues. I think modern medicine is great for certain problems. What is often missing is getting to the root cause and creating a plan to fix it. Many doctors focus on treating pain rather than addressing the underlying problem. I healed stomach ulcers without drugs by changing my diet and using natural supplements. I am recovering from running injuries with the help of supplements and a routine of exercise, stretching, and targeted pressure point release. I have learned to take matters into my own hands unless something is seriously wrong and I cannot resolve it on my own. Story 64. This morning I grabbed the metal handle of a pan that had been in the oven and burned my palm and the skin between my index and middle fingers on my dominant hand. I used gauze, a fingerless glove, and acetaminophen. Story 65. Acetaminophen Tylenol when the pain is severe. Otherwise, deal with it. Multiple sclerosis sucks. Story 66. I take naproxen sodium in the morning. If it does not work as well as I need during the day, I take 2 acetaminophen tablets. Because the pain is muscle pain from radiculopathy, I also use a foam roller and a shepherd's crook massager. Story 67. I take ibuprofen every day, wear a pain patch on my lower back, and use cannabis when my pain worsens. Story 68. I used a cash-based physical therapy practice. I was in pain for years while navigating the insurance system and was physically unable to work. I still have pain, but it is much more manageable. The pain specialist wanted to put me on medication. The orthopedic doctor recommended surgery. The chiropractor wanted to do endless adjustments. Enough was enough. It cost me less overall to see a cash-based physical therapist than to get multiple magnetic resonance imaging scans, medical massages, and other treatments that did not help my pain. Story 69. I have an appointment on Monday to hopefully figure something out. It is uncomfortable. Story 70. I am on a short-term trial of Jernavx and will receive a second round of platelet-rich plasma injections next month. Story 71. I developed plantar fasciitis from excessive running with poor form. I had heel pain when I started cycling. The heel is now slowly healing. Recovery will require a lot of time, physiotherapy, rest, and care. Story 72. Gabapentin helps a lot with my anxiety and fibromyalgia. Story 73. I have full Medicaid coverage from my state, but none of the doctor's offices want to see me. I have to take acetaminophen and lie there. That's it. Occasionally I get a Gatorade. Otherwise I am toast. Story 74. After years of physical therapy, I gave up and now treat it with monkey shoulder. Story 75. I take pain relievers and do exercises for my knee whenever I can. Other than that, I am just hoping the pain stops. Story 76. S-adenosylmethionine for arthritis pain. Takes months to make a real difference. Story 77. Physical therapy and cold beers. I use them as ice packs. Story 78. It has been 1 week since I cracked a rib. I am taking acetaminophen and ibuprofen. Why does it still hurt? Story 79. Tramadol 3 times daily, baclofen 3 times daily, half a narcotic tablet once daily, and acetaminophen and ibuprofen as needed. Diclofenac and meloxicam daily. 3 to 5 different sleeping medications as needed. Every 3 to 4 months I receive an epidural corticosteroid injection in my lower spine. This regimen keeps me mildly functional most days, but sometimes I am bedridden. Story 80. Possible treatments include paracetamol, cannabidiol oil, alcohol, and ignoring the problem, depending on whether it is period pain, migraines, joint pain, muscle strain, or a wound. Story 81. Take oxycodone, rest, and apply an ice pack. A physical therapist will see you in 20 minutes. The surgery was last Wednesday. Story 82. I am trying to keep weight off it. Do not sprain your ankle in your mid to late 30s, kids. It has taken a year, but it is finally starting to heal after physical therapy. Story 83. I have been taking ibuprofen and doing exercises to relax my lower back muscles. It has gotten a lot better over the past few days. I could barely hobble between rooms before. Story 84. What do you mean? I am just powering through it. It will go away or I will get used to it. Story 85. I am a 35-year-old patient with multiple myeloma and 3 fractured vertebrae due to the cancer. I am currently taking oxycodone 6 times a day, a muscle relaxant, morphine, and Lyrica. I am still in pain and would not wish this on my worst enemy. Story 86. Until I see the doctor on Monday, my current pain management consists of over-the-counter pain relievers, hot showers, and lying on either an ice pack or a heating pad. I am also alternating between Salonpas Deep Relief Gel and patches. Story 87. I do not treat physical pain. I am in my 50s and have everyday aches, but I am not a fan of painkillers. In the last 30 years, I have probably taken a couple of paracetamol. Story 88. I have severe lower back and buttock pain due to sacroiliac joint dysfunction caused by pelvic misalignment from overloading my gluteal and other muscles while walking 200 miles for charity. I had an osteopath perform deep soft tissue work yesterday to release the muscles. It helped somewhat. I will take the bruising over the crippling back pain. I will see him again on Tuesday and am hoping for the best. Story 89. Nothing can be done for my pain. I just have to suffer through. Story 90. I ignore it until it becomes background noise. If I take pain medication, I will feel it 10 times stronger once it wears off. Story 91. One of them was finally managed with steroid injections. The procedure was painful but worth it. Some pain still remains. Story 92. Ice packs, heating pad, dual action Advil, and self-massage. Story 93. I have fibromyalgia, severe bilateral facial pain, arthritis, bulging discs, and nerve pain. I am currently using heating pads, crying and rocking back and forth when it is unbearable, and taking acetaminophen. We are undergoing fertility treatments, so I cannot do much else. We already tried steroid injections, dry needling, trigger point injections, physical therapy, and other treatments. Story 94. I have a wad of phlegm at the top of my throat from acid reflux a few days ago. It is somewhat painful to swallow. I have taken a decongestant, and it is starting to help. This happens about once a year. It is very annoying. Story 95. I always live with it. If it gets too bad, I take 3 ibuprofen tablets, but that is fairly rare. Story 96. Get up and walk it off. Maybe rub a little dirt on it. Story 97. I have spinal stenosis, and yesterday I overdid standing. My legs and back are hurting badly. I took my usual gabapentin, which helps with the numbness in my left leg, and 600 milligrams of ibuprofen for the rest of the pain. Takes the edge off. I ran errands and walked slowly with my cane because if I just sit and rest, it is actually worse. Story 98. Tramadol is the only thing my doctor has given me that is providing a little relief for undiagnosed back pain. Story 99. My husband may have a slipped disc in his back. He is receiving physical therapy and using Rick Simpson oil, which provides most of his pain relief. Story 100. I have rheumatoid arthritis. I am currently taking Rinvoq and leflunomide to try to stop my overactive immune system from attacking my body. When I have a flare-up, I take a course of prednisone to calm the immune response and ibuprofen and kratom to ease the pain while I wait for it to take effect. I now exercise 3 to 6 days a week with different workouts each day because repeated stress on any particular joint can cause a flare. That routine has helped my flare-ups tremendously. Story 101. I have a torn meniscus causing an altered gait and back pain. I just took acetaminophen. It does not help the back much. Story 102. I am impatiently waiting to have my tonsils removed in less than 2 weeks. Story 103. I'm lying with a heating pad and just watching TV. I should eat, but I don't know what would help my stomach right now. I had too much spicy food for dinner, and my stomach has become more sensitive even though I've been eating better. Story 104. My knee was sore this morning, so I took an ibuprofen. I'm not sure why. I think I slept at a funny angle. Story 105. It depends on the wound. Sometimes nothing is needed, sometimes a patch or a pill, and sometimes hospitalization is required. Story 106. Various prescription medications do not completely stop the pain, but they help minimize activities that aggravate the pain. Story 107. I have been in physical therapy for months this year for pain. I am lucky to have coverage for it. I use heat and cold. I have tinnitus, so I avoid taking pain relievers until I have to because they exacerbate the ringing. Story 108. Hyping myself up to do my physical therapy routine after a busy, emotionally draining week. It really works, but I can't slack for too long, or the pain begins to return. 2 years ago, my occasional hip pain became constant and borderline debilitating for months. I thought I was too young for a hip replacement and wondered if I had fibromyalgia or another disorder. I tried every stretch and realignment pose from the book Pain Free, which had helped me in the past, but it didn't fix the problem. I went to physical therapy. The therapist watched me do a few movements, repeatedly pressed his elbow into my buttocks and pelvis, assigned specific strength-building exercises, and the results were incredible. Each week, the pain decreased until I was completely back to normal. I didn't fully comprehend how much pain I had been in until it was gone. I have to keep up the exercises forever, but that outcome was better than I feared. Now I can get away with slacking for about 2 weeks before the pain starts to creep back. Story 109. Edibles and 20 minutes with a transcutaneous electrical nerve stimulation unit provide relief. I have a frozen shoulder, and using the unit after stretching helps a lot. Story 110. I have received 3 cortisone shots in my left foot. I will see how I feel in a few days. Story 111. I have pretty bad osteoarthritis in my knees and shoulders. Over-the-counter Voltaren cream, diclofenac, is a godsend. Story 112. I'm just ignoring it until it gets to a point that ibuprofen will help. Story 113. 10 minutes ago, I hit my right shin on a shopping cart. I have not treated it and I am still in pain. Story 114. By masking or hiding pain with drugs, I make my mind and body think I am healed, so I worsen the injury because I am numb from the drugs. I have a very high pain tolerance and I know my limits. I have never needed pain medications and I never will. Story 115. I have 3 different conditions that contribute to chronic pain throughout my body. I live with significant pain but still need to work, so it is a combination of several conditions. The list is too long to include. Managing pain is a full-time job. Story 116. I use ice as needed and take ibuprofen when the pain is bad. I do exercises for my feet and calves to keep them strong and flexible. One foot is fused with 7 screws and a couple of titanium posts, so the arch in that foot is much lower than the other, and none of it is where it belongs. Story 117. My hip hurts from sitting, and my butt hurts as well. There has been no treatment. I am just letting myself slowly slip into despair. Oh, and I'm just warming up, I guess. Story 118. I took 1 ibuprofen and I am still hurting. That usually does not work, but I can pretend. It just hurts. My wife is in constant agony and she uses nothing for her pain. She is in pain all the time. Those of us with constant pain simply hurt. Once you are used to it, complaining seems like the best medicine. Story 119. I get small fiber neuropathy anywhere, anytime. I tried a low dose of gabapentin, but it caused too many side effects, so I decided to tough it out through the nerve pain. Story 120. Non-steroidal anti-inflammatory drugs, gabapentin, Xanaflex, tramadol, and a heating pad are used for chronic back pain. Story 121. I cried a lot, used lots of icy hot, and received back rubs from my boyfriend. Story 122. I use massage and stretching. Cannabidiol helps a lot, and I sometimes take mild pain medication. Story 123. An ice pack on my forehead as I eat Honey Nut Cheerios because I have to eat while waiting for my mom to come home with fries and a soda. Story 124. It is honestly a very depressing combination of marijuana and suffering. Story 125. I have chronic low back and pelvic pain. I am not sure whether it is a pinched nerve or a slipped disc. When I can sit with a heating pad, I use it. Some stretching also helps. Otherwise, I try not to think about it and cannabis helps. Story 126. I just try my hardest to ignore it and only use painkillers when it becomes unbearable. Story 127. I am about 9 weeks out from my total knee replacement and doing a lot of physical therapy. It still hurts. My knee and leg have been painful for years, so the replacement did not eliminate the pain. I am now undergoing intensive physical therapy to address this long-standing pain. Story 128. My pain is caused by pregnancy, so I guess I am treating it by waiting a long time. Story 129. I am just dealing with it. I cannot afford to get it treated. I have pain in my feet, heel, ankle, and knee with bone spurs, cuboid bone issues, and a limited range of motion. I hope it will find a new set point and my body will adapt. Story 130. Treatment? What is that? I have facet joint hypertrophy in my lower lumbar spine and sacroiliac joint pain, and they keep telling me this is normal for my age. No one has explained why I have sacroiliac joint pain either. I do have arthritis in my knees and hips, and my orthopedic specialist has performed injections, but my back has been referred to pain management. So far I have only used a heating pad and some hope. Story 131. I live with it. Over time, it becomes background noise. Story 132. Thank you for asking. I am a 49-year-old married father of 2 in the United Kingdom. I humiliated myself this morning by doing a proper dad run to catch a bus and pulled a muscle in my back. It is really painful. I am currently sitting on an electric heating pad and asking my children to stand on my lower back because, oddly, that pressure helps with the pain. Story 133. I am taking Advil and my anxiety medication, which is also a pain medication, so 2 in 1, laughing out loud. Story 134. 2 Aleve tablets. I have spondylolysis and I am on my period, and the tablets are working overtime. Story 135. My lower back has been in bad shape for years. It turns out my hips are misaligned and the lower horizontal portion of my abdominal muscles is weak. I have been doing corrective drills for a week, and the pain is subsiding while my posture improves. I plan to continue until my body adjusts permanently. Story 136. The lumbar vertebrae 1 through 5 are severely damaged. Anodin Extra is all I take. I do not trust the medications the doctors prescribe. Story 137. I'm not doing anything to stop the pain. I'm living with it. I go until the pain tells me I can't anymore. I take muscle relaxants, and naproxen is available over the counter. I have spinal arthritis affecting my sciatic nerve. When the nerve acts up, it can stop me using my left leg. The leg refuses to support me, drops me to the floor, and makes standing back up feel impossible. Story 138. Paracetamol, or whatever it is they have recently blamed autism on in the United States. I had hand surgery nearly 2 weeks ago. Story 139. If it is bad enough to require a hospital visit, go. If it is not, what is the point of doing anything about it? Story 140. Thoughts and prayers, mostly. I started sleeping with an extra pillow. That's really nice. Story 141. Tetrahydrocannabinol, autism in pill form, and a lot of swearing. Story 142. I'm ignoring the constant pain and weakness in my right knee, and even more so the pain in my tooth, neck, and upper back. Story 143. I use a hot water bottle, and if I have to leave the house, I take a painkiller. Story 144. I am taking high-end prescription pain medications, but am still in pain and awaiting an injection for treatment. Story 145. Right now I am taking nefapam, paracetamol, and tramadol, staggered throughout the day. I do have access to opioids, but I would rather not go down that road. Story 146. I have fibromyalgia, so I am always in physical pain. I try to stay active, work out, and spend time outdoors and so on. The pain is still there, but I try not to focus on it. Story 147. I have Ehlers-Danlos syndrome with hypermobility. All of my joints, and I mean all of them, extend far beyond what is typical, which has led to severe joint degeneration at age 24. I choose not to let it destroy my life or make me bedridden. I do the things that typical 24-year-olds do, and I work in emergency medical services. Today is my day off after a 17-hour shift yesterday, and all I can do is lie in bed. I cannot even get myself up to shower. The only way I can sleep at night is with a sleeping pill and marijuana. I have lived with the pain all my life, with doctors telling me to take 800 milligrams of ibuprofen twice a day. I do not do this because it does not touch the pain and it causes ulcers. I tough it out because doctors keep telling me there is nothing they can do unless I choose to be disabled. No, thank you. Story 148. It depends. If the pain is muscular, I rest, do mobility drills, and gradually work my way back up until I have full mobility and no pain. Story 149. If you are in physical pain right now, how are you treating it? I use ibuprofen and tetrahydrocannabinol. They help but have limits and drawbacks. Story 150. A special ancient technique. Ignoring it. When it is too much to bear, I use one of a few other techniques. Whining, a leave, or rolling a lacrosse ball between my shoulder and the wall. Story 151. Tylenol? I also bought a muscle massager that had 4 interchangeable heads that can pinpoint different muscle pain. It was in Walmart by the exercise equipment. My husband and I use it. Story 152. I have fibromyalgia, osteoarthritis, and I am recovering from uterine surgery. As usual, I am expected to just deal with it. I take acetaminophen and ibuprofen and hope they do not destroy my liver or kidneys before medical science finally acknowledges that fibromyalgia is not simply imagined. I was not given any painkillers after surgery. Thankfully, the surgery was minor, but far too many doctors still believe the cervix has no nerve endings. They are wrong. Story 153. I ignore it. I have been in physical pain in at least one part of my body for about 20 years, so I am used to it. Story 154. Deep freeze and tubular bandages, combined with ignoring it and wondering whether you can sprain your ankle too many times. Story 155. Watching House vicariously enjoy pain relief from all the Vicodin. Story 156. Pop a few autism tabs, pray to Robert F. Kennedy Jr., and buy the dip. Story 157. I have cramps and I am curled around an electric heating pad. Story 158. I'm in mental pain and what I plan on doing about it is my own business. I'm sorry you're feeling this way. Are you safe right now? If you are in immediate danger, call your local emergency number, for example, 911 in the United States. If you are in the United States, you can call or text 988 to reach the Suicide and Crisis Lifeline. If you are elsewhere, please contact your local emergency services or a local crisis hotline. If you want, I can help you find local support or stay with you while you reach out to someone. Story 159. I am treating it by lying here in a comfortable position and forcing myself to relax. It's tricky because I am naturally extremely tense. Story 160. I'm lying on the cold ground to reduce the inflammation. It's not working, but I'm uncomfortable. Story 161. I have bruised ribs. They hurt whenever I move, but I have to live with them until they heal. I'm not a big fan of taking many pain relievers, so I usually take them at night to sleep better. Story 162. Cervical epidural injections, lumbar injections, cortisone shots, narcotics, and surgery. Story 163. Exercise and Ozempic. My back pain is due to overeating and excessive worrying. Story 164. Taking a lot of Tylenol so I can get in on that sweet autism money. Sarcasm. Story 165. I grit my teeth and just push through it. I do not know why, but doctors freak me out. No one knows and probably never will. Story 166. I am dealing with a temporomandibular disorder flare-up. Beer and marijuana are my treatments tonight. Laughing out loud. Story 167. I am managing pain with acetaminophen and occasional changes in position. I am waiting for clearance to restart my Hiramas therapy. Story 168. I walk 3 miles every day and my pain subsides. Sounds crazy, but it works well for me. Story 169. Arthritis and menstrual cramps. Sometimes Tylenol. Currently eating macaroni and cheese. Story 170. My hand hurts from holding my phone too long. I need to get off Reddit and walk my dogs. Story 171. I am in my recliner because my back is killing me. I mowed the lawn and painted 3 walls, so I wonder why. I am going to start a heating pad in a bit. Story 172. I am sitting in a bathroom stall at a local corn maze and pumpkin patch, nursing an upset stomach because I ate a low country boil and a giant funnel cake earlier in the day. I am hoping to wrap this up soon so I can get home and try Battlefield 6, but I think I am stuck for a bit. No regrets. Story 173. The root canal today did not go as planned. As soon as they hit the nerve, everything went black. There was a bright flash and a severe shock followed by a burning sensation. My shoes flew off my feet. I screamed in agony, then laughed hysterically at never having felt so much pain in my life. It all happened in less than 30 seconds. Story 174. My plantar fasciitis disappeared after 10 years of using very good shoe inserts. My children have it, though. Story 175. Managing. There is no effective treatment for intractable neuropathic pain. I am using buprenorphine patches but hope to stop them soon to see if I can find a way to cope, since the pain is unlikely to improve. Story 176. I cannot get a knee replacement for a few more years, so I limp. That is my treatment. Story 177. When I have a headache, I ignore it until it goes away. For muscular pain, I try to walk it off. It may not be the most ideal strategy, but it works for me. Story 178. Meloxicam. I hope my upcoming surgery will have an impact on it. Story 179. I can't. My pain is caused by sensory triggers due to sensory processing disorder. I feel that life is pain, comfort is a lie, and agony is my only true ally because it never leaves me. Story 180. Unhinged, but it works. Using Korean injectable lidocaine in my trapezius muscles when I have a bad flare-up. Story 181. I have electrical stimulation pads on my back. I'm on several medications for a bulging disc pressing on a nerve. Nothing works. I get an injection next week. I'm hopeful but skeptical. Story 182. In August, September, and again last week I told different clinicians, doctors, and a physician assistant that my right ear hurt. Each examined it and said there was nothing wrong. I am sitting on my couch crying with an earache. Story 183. My feet are on fire from walking too much after being sedentary. I have to sit down and wait it out. Story 184. I have a frozen shoulder following a double mastectomy. I received a cortisone injection for it. I regret that decision. Story 185. I experienced severe back pain from lifting my 19-pound, 7-month-old baby because I have no core strength after a cesarean section. I receive massage therapy and attend physiotherapy, but I struggle to do the exercises. My husband kindly massages my back every night. Story 186. I have acetaminophen and know I must keep moving, or my children will destroy the house. Story 187. My mom has had chronic back pain for a long time. She has tried many medications and interventions. The latest is a 7-day buprenorphine patch that delivers 5 micrograms. It seems to have reduced her pain rating from 7 out of 10 to 4 or 5. A major advantage is not having to track opioid pills 4 times a day. I think it is providing modest but more consistent relief. Increasing the dose to 10 micrograms caused dizziness, so we are staying at 5 micrograms. Story 188. I am taking tetrahydrocannabinol and will receive steroid and ketorolac, brand name Toradol, injections in my back. Honestly, that is it for now. Flat back syndrome and some retrolisthesis are causing severe problems in my spine, but we will consider fusing the remaining problematic vertebrae in 5 to 10 years. Story 189. That depends on the type of pain. If it is inflammatory, my go-to is Creeping Charlie. The plant grows wild in my yard and replenishes very quickly. It does not taste great because the larger leaves are somewhat bitter and very minty, but it helps a little when added to a salad. For general aches, I usually use a hot water bottle and reduce use of the affected muscle as much as possible. For anything worse, a traditional over-the-counter pain reliever will have to do. Story 190. I have irritable bowel syndrome and diverticulosis. I take medication to help with cramps when they are severe. Otherwise, I use peppermint tea, a heating pad, though I use it rarely and only in winter because I am sensitive to heat, and I make sure to consume plenty of fiber and water. I also lie on my stomach to apply gentle pressure, which can help relieve cramping. Right now, I have had tea and am lying on my stomach. I also walked earlier, so hopefully I will pass gas or otherwise find relief. Story 191. Naproxen, a heating pad, and a stuffed monkey for severe cramps. Story 192. My knee got so bad that I could not walk down a single stair without tears. Physical therapy, cycling, and strengthening the surrounding muscle groups relieved about 90% of the severe pain. Ketamine helped on the very bad days, but it is not something you want to use regularly. Story 193. I ignore it until it goes away. The electric shock, burning, or stabbing needle sensations come and go at random because of a hereditary condition. Sometimes rubbing the affected area, such as the hand, knee, chest, or elsewhere, helps it subside a little faster, but often it makes no difference. Story 194. Low dose of naproxen. I cut a 220 milligram tablet in half and it helps a bit. I think that is safer than taking a full 220 milligrams daily or every other day. Story 195. The last 5 days I have had pain in my neck and lower back. Sometimes it is excruciating. I have just been walking and resting. If it does not get better soon, I will take a leave and may have to see a doctor. Story 196. I am taking pain medication and resting. I have had migraine symptoms all day, and when I sit or stand, I feel nauseated. Story 197. Finally got my second cortisone injection in my back on Tuesday. That made me feel worse until today. I have a follow-up with my doctor on November 4th. Maybe now I can get my surgery. I hope the workers' compensation carrier does not contest this further. In the meantime, I am taking prescription ibuprofen and a muscle relaxant, but they do not help much. Story 198. I have a sore hip and knee at the moment. I am using a small amount of Voltaren and Nurofen, and a heat pack, also known as a heated sock filled with rice. Story 199. Tylenol and a hot shower do not do much. I think something is being missed at the doctor's office because the staff do not seem concerned, but this is preventing me from living my best life. I feel stronger anti-inflammatory medication may be needed. Story 200. I have chronic low back pain, severe sciatica, and psoriatic arthritis. I have been dealing with it for about 15 years. The best remedies I have found are squats and the Mackenzie method. I am not saying it would work for everyone. It sounds counterintuitive to suggest heavy squats to help a bad back, but they work for me. I am never completely pain-free, but my pain drops from an 8 to a 3 after a workout. Story 201. For menstrual pain, acetaminophen and raspberry leaf tea help ease cramping. Story 202. It is the usual treatment for my chronic pain and dissociation. Story 203. I had a migraine all day. I took all the medications I could earlier, but it still lingered. I took my muscle relaxant before bed. Story 204. Lying down and watching Moomin Valley, laughing out loud. Nothing else is really worth doing. Story 205. Ignoring it and doing more of what caused the pain. Story 206. I've had visual snow or chronic visual migraines for 30 years. I just deal with it. There is nothing anyone can do. Story 207. Tylenol, my regular medications. Hydroxychloroquine, Lyrica, and meloxicam. Massage gun, heat. Story 208. I've tried doctors, physical therapy, medication, stretches, orthotics, injections, imaging, cold laser therapy, ultrasound therapy, and a few other treatments. At this point, I'm crying a lot and feeling irritable. Story 209. I have no job to pay the bills and even less for medication. I sit with a warm water bag to calm down while I scroll Reddit and apply for jobs, waiting to get money for the surgery. Story 210. Mind over matter. I do not mind, so the pain does not matter. Story 211. Cannabis, Nurofen, Tiger Balm, Voltaren gel, hot shower. I really need some morphine. Story 212. I have chronic, constant pain and use 3 treatments. First is extra strength acetaminophen. If I feel the pain will not be controlled by acetaminophen, I add a gummy. If the pain is severe, I take a narcotic. I start with a half dose and, if that does not work, I take the other half. If I need to be out and about, I take a half dose while getting ready because I know it will affect me. I typically take the other half when I need it. Story 213. I keep gradually removing bits of decay with a toothpick. Story 214. I just go about my life as normal, complain, and hope that anything I do to help makes a difference. Story 215. I have had a chronic back issue that has caused varying degrees of difficulty for about 25 years. Eventually, I learned to think of it as only pain. I take over-the-counter pain relievers and prescription muscle relaxers when it's extra bad. Story 216. Gabapentin, meloxicam, acetaminophen, Tylenol, famotidine, duloxetine, lidocaine, diclofenac gel, methocarbamol. Story 217. If I wake up and nothing hurts, I start to think I'm dead. Story 218. Using a massage gun, I rub my fingers against the pain hotspots in my body. Story 219. I begged my doctor for naproxen the other day. It is not perfect, pain is still present, but it could be worse. A friend gave me Lyrica because he had been prescribed it, and it helped a lot with anxiety and leg and hip pain. Otherwise, I use a transcutaneous electrical nerve stimulation machine for my legs, a hot water bottle on my stomach or back, and a lot of Voltaren gel for arthritis. I also use a cold compress on my forehead for migraines and wear knee and hip braces and compression socks. Getting pain relief medication from a doctor is very hard. Most assume ibuprofen or acetaminophen should suffice even if you are in 10 out of 10 pain. It is even harder when you are a young woman. Everything gets blamed on mental health or menstrual issues. Medical negligence is real, and doctors often react too late. Story 220. I am taking ibuprofen at the moment, receiving trigger point injections, and monthly lidocaine infusions. I had 2 nerve blocks that were unsuccessful. I have myalgias across my back, arthritis in my lumbar spine, and a pain condition called neuralgia paresthetica. I average a 7 out of 10 on the pain scale most of the time. Story 221. I do not take prescription or over-the-counter pain medications. I just deal with it. Story 222. Chat generative pre-trained transformer told me how to deal with my Achilles tendonitis after diagnosing it. Story 223. I have been in physical pain for about 5 years. Honestly, you learn to live with it and how to move without hurting as much. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.